Hello, this is Lance French. This video is for the IV change of a continuous IV to a lock. The first thing I would do is approach the patient, perform my hand hygiene, identify the patient with two means of identification, and then check my 6 rights of medication administration, being the correct documentation, the correct route, correct patient, correct time, correct medication, and the correct dose. Now that I see all of those are accurate, I would obtain a medication administration record and a order from the healthcare provider. So firstly, I'm going to check the standard things such as patient safety, privacy, body mechanics for myself and the patient, ensuring that they're in a safe position. And I'm going to access the IV site and determine that patency is present on this IV site. So firstly, I'm going to lock this IV. So I'm going to stop stop its progression. And I'm going to expose the catheter hub here and loosen any tape that I need to. So I'm going to place some gauze between the patient and the IV hub. And I'm going to obtain my 0.9% normal saline. And clean this hub with the alcohol, allowing it to dry, as well as cleaning this saline flush. I'm going to administer 5 milliliters. Okay. Reconnect this, seeing that it is still locked. Now I'm going to explain to the patient how to, and do some patient teaching of how to maintain the lock here. And I'm going to document all the relevant information on the MAR, being who I am, what time I did these things, what I did, and that would conclude the first series of this assignment, being the continuous IV lock to the continuous IV, which was occurring initially and now it is locked. So now I'm going to show you how to do an IV push medication through a saline lock. Again, the first thing I need is an order from the healthcare provider and the MAR for this medication. And I'm going to do the 3-check method, determining the rate to administer this medication and what sort of IV push is specified. So 5 milliliters I see is to be specified here, and then a medication administration, and then 5 milliliters after that. So firstly, I'm going to obtain a new and clean 0.9% USP sodium chloride injection for a saline flush. So I have this is locked now. I can disconnect this hub. So I'm going to open a new alcohol, and I'm going to clean this hub, allowing it to dry before I attempt to administer anything. Okay, I'm going to administer my 5 milliliters of saline flush. Okay, now that's performed. I'm going to set that aside. Now I'm going to administer the medication that is specified in the order, and I'm checking it on its vial. And cleaning the hub and the medication syringe. Okay. So this is the medication that is now administered. So I'm going to clean my hub again and obtain a new 5 milliliter flush solution in a syringe. This I see that 5 milliliters is flushed now. And I'm going to observe the IV access site. So I'm inspecting for any redness, swelling, pain, tenderness, any infiltration. And so I've removed that flush. I'm cleaning these ports and hubs with alcohol. Okay, now that's connected again. And now I will dispose of the equipment using sharps when necessary. And my goal is to leave the patient in a safe, comfortable position, bed at its lowest height, call device within reach of the patient. And that concludes the section of IV push medications through a saline lock. Now, we have to show you the last aspect of this, which is discontinuing an IV infusion. So I'm going to don some clean gloves. Okay. So I'm going to identify the patient with 2 means of identification and make sure that I'm prepared to document everything I've done in the MAR. So firstly, I'm going to loosen this tape carefully while holding the catheter. And I'm going to have my sterile gauze ready. Okay, I'm doing that chevron. And just double checking that this is, the valve is locked. So we'll withdraw the catheter from the vein. Okay, applying firm pressure on this for about 3 minutes. And I'm making sure that the entire and intact catheter has been removed from the patient's vein. And I'm examining for any infiltration, any redness, swelling, any tenderness reported from the patient or inferred from me. So that's waiting for this. This gauze is doing its work. So I have a sterile dressing here. I'm going to put over that. And I'm going to apply this tape to maintain pressure on the dressing so that patient can heal. Now, I'm going to document everything in the medication administration record, my name, what I did, what time I began, what time I ended the site, the patient, any complaints, who the patient is, any complaints or feedback I gotten from the patient. And that concludes my discontinuing an IV infusion for my return to demonstration. Thank you. I'm going to perform hand hygiene before I leave the room and clean up all my things. Leave the patient in a comfortable position, lowest position possible with their bedding, and that is my conclusion.